This is the case of a 5-year-old male child who was brought to the hospital after falling from a motorcycle. According to the attendants, the child fell on the road and sustained a visible injury to his head. There was a small wound on the right side of the scalp, and the area was bleeding at the time of arrival. The child was crying continuously and appeared frightened and restless due to pain. His mother was extremely anxious, holding the child in her arms while trying to comfort him. The emergency medical team immediately attended to the patient. On initial examination, the child was fully conscious, but very irritable. His pulse rate was slightly elevated, and mild swelling was observed around the injured area. The wound measured approximately 2.5 centimeters in length with superficial bleeding. No signs of vomiting or loss of consciousness were reported, which indicated that the injury was likely limited to the scalp. However, careful observation was required to rule out any deeper damage. The doctor reassured the parents and explained that the wound would need to be cleaned and sutured under local anesthesia. After obtaining informed consent, the procedure was started under strict aseptic precautions. The surrounding area of the wound was gently cleaned with antiseptic solution. A small amount of local anesthesia was administered to numb the region, and within a few seconds, the child stopped reacting to pain. He was then positioned comfortably on the examination table while the medical staff kept him calm. Once adequate anesthesia was achieved, the doctor explored the wound carefully to check for any foreign bodies or contamination. Fortunately, no debris or glass particles were found. The wound edges were freshened slightly, and 2 to 3 stitches were placed neatly using fine surgical thread. A sterile dressing was applied over the area to prevent infection. The entire procedure was performed smoothly, and minimal bleeding occurred. Throughout the procedure, the nursing staff comforted the child by talking softly and holding his hand. Although he initially cried and moved restlessly, he gradually became quiet as the treatment progressed. After completion, the doctor re-examined the wound, confirmed proper closure, and gave instructions to the parents regarding wound care. They were advised to keep the dressing clean and dry, to avoid touching the wound unnecessarily, and to return to the hospital if any swelling, redness, or discharge appeared. Pain relief medicine was prescribed, and the parents were instructed to administer it as directed. The doctor also recommended follow-up after 5 days for dressing change and stitch removal if healing progressed well. The parents expressed their gratitude to the medical team for their gentle handling and care. The child, though tired and weak, was stable and calm when leaving the treatment room. He was advised to rest, avoid outdoor play for a few days, and take proper nourishment. This case highlights the importance of immediate medical attention in head injuries among children. Even minor falls can result in significant trauma due to the soft structure of a child's skull. Timely wound cleaning, local anesthesia, and suturing can prevent infection and promote rapid healing. It also demonstrates how a calm and reassuring attitude from the healthcare team can help reduce a child's fear and anxiety during treatment. In conclusion, the 5-year-old boy who fell from a motorcycle received prompt and careful management for his scalp wound. Under local anesthesia, 2 to 3 sutures were placed successfully. The child tolerated the procedure well and was discharged in stable condition with complete instructions.